Next. These are the basic formulations which are used in Rasoushadhies. 𝐿 𝐕𝐢𝐬𝐢 𝑎రోగ్యవర్ధిని తామ్రగర్భ విషగర్భ పొట్టలి. Next. This is a case of cirrhosis of liver. You can see the patient was almost in ICU and it was being told like almost it's a tag and you can inform the family people about the condition of the patient. You can see here the report of this particular patient has been told as a liver parenchymal disease, cirrhosis. So for this particular patient, we have given Tamragarbha Pottali, Kumaryasava, 𝑒𝐿 and 𝑎రోగ్యవర్ధిని. You can see the same patient has come outside by walk from the intensive care unit after 15 days. You can see the report there, absolutely no cirrhosis. In the next report of the same patient, the cirrhosis has been well addressed, and these are the reports of the same patient, whereas liver is being said to be in normal contour. It is in normal contour, and this is what a drug can do. This is called as a 𝐿𝐺𝐵 𝐅𝐚𝐿. You can address a liver cirrhosis in such conditions. Next. Next. This is another case, very common nowadays, 𝐻𝐵 positive. She was a case with 𝐻𝐵 carrier for almost from past 15-20 years. These are the various reports in between, and recently she had been undergone a surgery wherein she was treated with only 2 grams of Tamragarbha Pottali per month. This was a dosage been given for almost 2 years. And after 2 years, she had to go for a tubectomy. So for that she was being investigated. 𝐻𝐵 came to be negative. She was being addressed well. So the test was being repeated after 3 months again. And even after 3 months it was further negative. So the slide was taken and a pic was captured because the things might be edited. So it is 𝐻𝐵 there and you can see it is negative. So this is how we can address for a chronic situation like the carriers. And only one drug, Tamragarbha, was given to the patient. Next. 𝐾𝐿 set of drugs. Of course, it's a very big chapter of 𝐾𝐿 to be dealt with. There are many things which we need to understand in the chapter of 𝐾𝐿. These are few of the prescriptions like the Pravanagarba, Lohagarbha, Talakeshwara and Sarveshwara Parpati. You can see the patient condition before and after treatment with the psoriasis condition. The only thing which we need to think so very seriously here is about the immune system, their autoimmune disorders. Don't alone treat them with 𝐾𝐿. Treat about their autoimmune system. You have the episode being totally normal now, but the patient will have relapsation there after certain time. There is no fun in treating the patient with only 𝐾𝐿. We have to immunomodulate him. We have to see something like his immune system is back to the normal so that his body is capable to fight with the illness and the skin lesions are not recurring in future. That's very important factor. Wherein I usually go with Hemagarbha and Pravanagarba to all my psoriasis patients for a very long time. I give it for possibly for 3 years, 6 years, 8 years and all in a very small dosage. Of course, almost I can say it's a subclinical dosage. I give it for a very long time just to see that autoimmune system has been well addressed, and at least in 80 or 90% cases, I don't see any relapsations. Even in psoriasis-like conditions or any of the autoimmune system. It might be rheumatoid arthritis or anything else. Either of these conditions, I try to see the drug is very pinpointing at a subclinical level for a very long time. Next, please. This is a praiseworthy drug, Sarveshwara Parpati Antavidruti Adhikara Rasaratna Samuchaya. This is acting wonderful in all the malignancies. The ingredients are the index of Rasashastra, indications are the index of 𝐾𝐿. So it acts on all the diseases. So you are having a doubt like whether you need to give what drug to be given, blindly you give this, he will definitely act. This is a wonderful drug. Next. Shotodushti Chikitsa. It is Visarpahara, Dadruhara and Pamahara drugs. Next. Shvidrahara. Next. Next. Pemphigus vulgaris, autoimmune again, it is need to be addressed. Here we have to give more of gold. Means Hemagarbha should be given more to control the situation, or else Pemphigus vulgaris is not going to come to control. This was a very pathetic condition of this particular patient, had all over the body, almost like Kardama Visarpa. But now she is having in only one small area in the finger, and she has a history of nearly 6 to 8 years. Now she don't have any episodes from the recent years. Next. Gulmanashana. Next. So these are the gulmas of the GAT, as I told you. Normally what I do is, I don't know whether I'll have time to project the video of the same. Through the endoscope, we enter into the patient body, we go to the area where the malignant tumors are there. We take the potalis which are being scraped outside with the suitable anupanam. It is sprayed with the help of a sprayer which is there with the endoscope instrument to the local area. Sometimes we make a small injury or just, whenever it's a malignant tumors, it bleeds on touch. So once you make a small injury, the absorption will be quite high. So instead of giving 125 milligram oral route wherein it spreads all over the body, I go through the endoscope, spray it only to that particular tumor area and see that the absorption is being done well. Later I spray with lots of distilled water to flush it away. Just like you see the Arshas Chikitsa with Kshara, like it shrinks. In the same way the tumor shrinks. We have case reports of so many patients wherein you have dysphagia like conditions. Dysphagia is being well addressed in case if it is because of a tumor growth by doing this particular procedure. So it depends on many factors wherein we are going with, and this is certainly such cases. Usually we are going here is with Vishagarbha with Panchavalkala Anupanam, or we are going with the ant egg juice. Next. This is red ants. It's very common in Western Ghats. It's used as a folklore medicine in most of the malignant cases. So few of the patients like tribes and all try to get it because it's there into their folklore practices. This is mixed with the potalis and it is being sprayed through the endoscope to the patient. Lesions. Next. Yeah, this is another case of CA gastrium. You can see it is mixed along with Panchavalkala Kvata and it is being kept stagnant there over the tumor. Next. Yeah, this is a case of a similar condition, a necrotizing type of tumor all over the abdomen. She herself is a pathologist and she has undergone with this particular CT abdomen. You can see the spread of the malignancy all over the abdomen, including huge necrosis in the abdomen. So for this particular patient, you need to rejuvenate the internal necrosis and also address the tumors. So on these conditions, for this particular patient, we have given that Sarveshwara Parpati. Along with Hemagarbha and Lohagarbha, you can see the CT of the same patient after 45 days. Next. You can see the CT of the same patient. All the necrosis are addressed well. Absolutely no necrosis in the abdomen. And even the lesions are significantly reduced. So this is what we can plan up with the treatments. And there is how we can address the situation well. Next. These are the Shrotas and Shrotamula. Next. Dushti Lakshana and Veda Lakshana. Next. Next. Tvak Dosha Shamana, Mamsarva Shrotas. Next. Kushtahara Chikitsa. These are the set of drugs of Kushtahara. Next. This is a case of SLE. Of course, as I told you again, autoimmune factors should be addressed well. For this, we have prepared our own preparation called as a 𝐷𝐸𝐿𝐴. We are adding all the Raktavarga Dravya from the herbal group. 𝐷𝐸𝐿 we are adding from the mineral group, and we are giving it in the form of a lepam. We prepare oil even of 𝐷𝐸𝐿. We give you the powder of the same content, and we are applying it for the patient. You can see the difference in the patient condition. She was literally jumping something like Agni-Visarga. She is having burning sensation all over the body. And this particular patient she's not Indian, but still she was unable to sustain the temperature of Bellary. Bellary is usually with 45 degrees. So it's very difficult for sustaining that particular temperature, especially with these patients. But with the 𝐷𝐸𝐿, of course, along with the oral medications like Lohagarbha, we could address the patient condition very well, and you can see the changes in that particular patient. Absolutely no problem at all to the particular patient. Next. This is 𝐕𝐢𝐬𝑚. Next. This is the churna of the same drug, which is given for the lepana. Next. This is Galaganda. Next. These are the cases of goiter. You can see the nodular goiter, the measurements of the goiter, and the isthmus which has been hugely enlarged. So in all these conditions, wherever you have the goiter-like pathologies, don't directly go into the chapter of gulma or some growths and go to treat them. The first thing is, what is a mula? Treat the Agni. The patient, what complaints he is having? He is having some Agni Vikara. Either he has built up his weight, he has lost his weight, he is having some alterations in his digestion. I simply give only Chandraprabha and Aarogyavardhani. I don't treat them with anything else. Simple Chandraprabha and Aarogyavardhani. The patient usually responds very well. Very well he responds. Possibly sometimes I give it Dashamulakvat as Anapanam. In case if it is a nodular goiter like conditions, I give Tamragarbha. In case if there is no nodular presentation, I don't give Tamra also. With simple Chandraprabha and Aarogyavardhani, the patient is well addressed. You can see the reports of this particular patient with the thyroid scan. Next. Sizes of the thyroid is being significantly reduced for every 3 months. Next. You can see the size, isthmus is totally normal here, and even the thyroid gland is totally turning to a normalcy. Next. This is another case of thyroid carcinoma. Because you neglect the thyroid conditions, it lands up into thyroid carcinoma. There, you definitely have to give Tamragarbha along with Hemagarbha. This is a positive case. You can see the report of this particular patient. And next slide. Yeah. This is also spread all over the body. She had a spread of all over the body, including the cervix, uterus, abdomen and all. Next. You can see the report of FNAC of the thyroid. FNAC of the right thyroid nodule. You can see the last line of the first paragraph. No evidence of any malignancy seen in the smear evaluated. FNAC report said no malignant cells, which was positive in the previous slide. So this is what we can do with the thyroid malignancy like conditions. For either of these conditions, as I told you, Tamra is a good drug. Tamra and Swarna. These two are highlighting drugs where we need to give in these conditions. Next. People are worried giving Rasoushadhies. See the creatinine level. She's taken it almost for 3 years. Rasoushadhies, huge Rasoushadhies. My cases of malignancy, I give almost up to 15 grams per month. Believe me, I give up to 15 grams per month. But it doesn't mean, but I prepare the medicine, I procure my own raw drugs, I prepare Bhasma myself, I give it to my own patients. So, the quantity, what I say, in emergency conditions, I give to high doses as well. Next. Vrukashula, Vrukashotahara, Katigraha, Kativedanahara, with all the conditions wherein with the Medovashrotas. Next. Next. Okay. These are the prescriptions where you have a radiating type of pain. Malla Garbha Pottali or Malla Sindur is a drug of choice. You have a stagnant pain. Vatsanava is a drug of choice. Any Vatsanava preparation or single drug Vatsanava, I give Vatsanava along with the Kankana and small quantities of Avibhatikara Godanti to the patients where they have only Katigraha or Katishula. In case if it is a Gradrasi-like presentation, I give them with Malla Sindura. Single drug is enough to treat the patient. In case if you want to increase the bulk of the medicine, Malla Garbha Pottali is given along with Kupilu Churna, Shodhita Kupilu Churna, along with small quantities of Avibhatikara Godanti and given. Absolutely they are addressed well. No, absolutely no problem at all. They are definitely to be addressed well in all the stagnant pains and radiating pains. Next. This is a calcite crystal spatika which is used into the Katipasti. As I told you, I adopt Rasoushadhies into Panchakarma. So here, this is how I adopt the Spatika Mani, which is very good Shula Prashamana, wherein the patient will have an immediate effect of reducing Shula. And this is what I want. I want the patient to be more comfortable so that they'll gain confidence in you and your treatment protocols. Next. Prameha Hara Chikitsa from the Medovashrotas. Next, please. Prameha Hara. Next, please. This is a Sasyaka malachite crystal, which is said as good Pramehagna. Sasyaka comes into Maharasa, wherein it is being kept while doing the Bashpasveda. You can see over the forehead, this is a Sasyaka Mani. It's a malachite crystal, very easily found in the market, it's not expensive drug. We ask the patient to keep it with them, Mani Dharana. Mani Dharana doesn't always mean like you have to wear huge necklace, bangles and all. No. Mani Dharana is keep the money with you. That's all. So here we are doing it like this. Mani Dharana into Bashpasveda for the Pramehi patients. Next. Like this. Next. This is malachite.